All right, let's jump right into this explainer. Today, we're looking at the thorax. We're going to uncover exactly how this unbelievable piece of biological engineering acts as both the impenetrable protective armor and the dynamic, vital engine room for our most crucial organs. It really is a masterpiece of design, so let's break it all down.
To help us map this all out, here's our agenda. We'll take an outside-in journey today, starting at the protective thoracic cage, moving through the thoracic wall mechanics, taking a look inside the mediastinum, checking out the lungs and pleura, and then wrapping up with the actual mechanics of breathing. So let's kick things off with Section 1, the protective thoracic cage. This is our body's outermost layer of armor.
What's really fascinating here is how the ribs articulate, right? They connect with the vertebrae in the back and the sternum up front. This dual attachment creates a barrel that is incredibly strong, yet surprisingly flexible. And that specific design is absolutely crucial. It's the foundation of our chest's ability to take a hit and protect our heart and lungs while still expanding enough to actually let us breathe.
If we look a bit closer and break this down, you actually have 3 distinct types of ribs, and it's all based on exactly how, or honestly, even if they anchor to the front of your chest. The first 7, those are your true ribs because they lock directly right into the sternum. Right below them, ribs 8 through 10 are the false ribs. They kind of piggyback onto the cartilage of the rib right above them. And then those last 2 at the bottom, those are floating ribs. They only anchor to your spine in the back, leaving the front completely unattached. But man, what happens when this perfect armor fails? Well, you can get a really dangerous, agonizingly painful condition called flail chest. This is where multiple fractured ribs essentially break away and move totally opposite to the rest of the chest. So instead of expanding outward like they should when you inhale, that broken segment violently sinks inward. It creates an absolute mechanical nightmare for your respiratory system. Moving just a little bit deeper from the bone, we hit Section 2, the thoracic wall mechanics. Let's look at the vital supply lines hidden inside.
Okay, here's a super cool detail to keep in your back pocket, the VAN configuration. That stands for vein, artery, nerve. They run in that exact, specific order, tucked securely away in the costal groove right under the lower edge of every single rib. Think about that. Nature literally carved out a protective trench in the bone just to make sure these highly sensitive vessels and nerves don't get crushed. And this brings us to a really major clinical point. The first rib, right at the very top, is incredibly thick and short. It takes an immense amount of force to break it. But if you do fracture it, you risk catastrophic injury to the subclavian vessels and the brachioplexus nerves. Basically, you're threatening the major plumbing and wiring that feeds your entire arm. Let's peel back another layer. Section 3, inside the mediastinum, which is essentially the central, high-speed highway of your chest. This space right between the lungs is just densely packed. Mentally mapping it out helps a ton. At the top, the superior region is holding heavy hitters like the superior vena cava, the aortic arch, and your trachea. Just below that, the anterior region is mostly thymus remnants and fat. Then you have the middle region. This is the busy intersection holding your heart, the pericardium, and the roots of those massive great vessels. Finally, the posterior region acts as a crucial transit corridor, with things like the esophagus and thoracic aorta heading straight down into the abdomen. Pushing laterally out from that busy center, we arrive at Section 4, the lungs and pleura. This is the actual machinery. Now, your lungs don't just sit bare in your chest cavity. They are beautifully shrink-wrapped in a 2-layer sac called the pleura. And the contrast here is wild. The outer layer, the parietal pleura, is highly sensitive to pain. But the inner layer, the visceral pleura that actually touches the lung itself, it feels absolutely no pain at all. This double-layered system uses just a tiny drop of fluid to stick the lungs to the inner chest wall, completely eliminating friction. It lets these massive organs glide effortlessly against your ribs every single time you take a breath. So, what happens if that pleural vacuum seal gets broken? Well, you get a pneumothorax. Air rushes into that space, that totally crucial negative pressure is lost, and the lung simply collapses. Without that vacuum physically holding the lung open against the chest wall, the organ's natural elasticity just takes over and it shrinks down, literally like a deflating balloon. Let's look at the airways for a second. The architecture here actually differs left to right. The right main bronchus is quite a bit wider, and it drops down way more vertically. This is exactly why if someone accidentally inhales a foreign object, like a peanut or a small toy, it almost always gets lodged on the right side. Gravity and anatomy are working against you there. That right bronchus acts like a direct, wide-open slide.
And when these intricate pipes face chronic disease, they react in completely opposite ways. With asthma, chronic inflammation causes the airway's smooth muscles to spasmodically constrict and narrow. But bronchiectasis, that does the exact opposite structurally. It chronically destroys and permanently dilates those bronchial elements. Both of these conditions make breathing incredibly difficult, but for entirely different mechanical reasons.
Because of all this asymmetry in the plumbing and the chest cavity, your two lungs aren't actually identical twins. The right lung is the heavier workhorse. It's got 3 distinct lobes. The left lung, on the other hand, is a bit smaller. It only has 2 lobes, and it features this really elegant cutout called the cardiac notch, specifically to physically make room for your heart. It's the ultimate spatial compromise.
If fluid ever builds up around these lungs, which is called a pleural effusion, doctors have to drain it using a thoracentesis tap. They carefully target the spaces between the 7th, 8th, or 9th ribs. Why there? To safely drain the fluid without accidentally stabbing the diaphragm, liver, or spleen. Oh, and remember that VAN setup we talked about earlier, vein, artery, nerve? Doctors have to meticulously insert their needle just above a rib to ensure they don't strike those sensitive vessels hiding safely beneath the rib right above it.
All right, that brings us to our final section, number 5, the mechanics of breathing. Let's see this engine actually in action.
We've seen the outer armor, we've seen the pipes and the balloon-like lungs, but how do we actually pull air in from the outside world? There's no motor in there. It all comes down to some basic physics paired with brilliant muscular action.
It's really an elegant 4-step process. First, your diaphragm contracts and pulls straight downward into your abdomen. Second, that active movement suddenly increases the overall volume of your chest cavity in almost every direction. Third, because the container just got bigger, the internal pressure drops below the pressure of the room you're sitting in. And finally, air just naturally and passively rushes into your lungs to fill the vacuum and equalize that pressure.
And to bring it all full circle, contrast that active work of breathing in with a quiet breath out. Normal expiration is entirely passive. Your muscles just relax, and the natural elastic recoil of your lungs simply pushes the air right back out. It's exactly like letting go of a stretched rubber band. The tissues just snap right back to their resting state, clearing the air out, getting you ready for the very next breath.
You know, your body orchestrates this unbelievable mechanical symphony of bone, muscle, and negative pressure over 20,000 times a day. And you do it without a second thought. It really makes you stop and wonder, what other unseen anatomical marvels are working behind the scenes, keeping you alive right at this very second? Thank you so much for exploring the thorax with me on this explainer. I really hope it gives you a newfound appreciation for the incredible engine room inside your chest.